You're supporting young people across Australia with mental health, physical health, alcohol and other drug issues, and vocational services. So the way you capture, share, and report information has a direct impact on how smoothly those services can be delivered. And all of this while you're trying to coordinate across teams and, importantly, meeting those reporting obligations that matter to your funding. So this forum is really about connection. It's about bringing together all of this group and all of the people who use MasterCare in their day-to-day work to share insights, raise challenges, and explore how we can improve. So from today's session, I'm really hoping that you can take away 3 things. Learn, hearing about updates, new features, tips that can make your use of MasterCare Plus much more efficient. Share. So raise questions, raise challenges, bring ideas from the front line of care delivery to this forum, and shape and influence how working with MasterCare continues to evolve to meet the needs of you and the people that you're working with. So we know that our customers use MasterCare in a whole lot of different ways. And each of the touch points isn't just about data. It's about creating a really clear picture of a young person's journey through your services. When we get it right, we absolutely reduce duplication. We improve the way that we coordinate and ultimately spend more time with our clients and less time wrestling with systems. So thank you very much for taking the time to be here. Your voice to us is super important. It shapes how we continue to develop M+. So through this session, I really, really encourage you to contribute, ask questions, share your experiences. This is a space where the insights of one person can spark a whole raft of solutions for everyone else. So I'm delighted to introduce some of our key team. Emily Manning is your sales manager. Phoebe Hunter is going to be presenting most of this webinar. Phoebe is your account manager. Matthew Cherian is our Global Health's Managing Director. We have Damon Gronveld, who is our Chief Technology Officer. We're all very much listening today. And you've got the right people in the room. So if you have questions, either put your hand up, ask the question, drop it into the chat. We'll be monitoring and we'll respond. So with that, that's enough from me. Let's dive into the agenda and over to you, Phoebe.
Thank you, Tanya. And hello, everyone. Thank you for joining today. I will just let you know, because I am presenting, I can't actually see you all at the moment. So we have Emily that's monitoring the chat. So if you do have any questions, feel free to pop them in the chat and Emily will notify me, or please do take yourself off mute and shout out. I really don't mind. So yes, so we will begin the recording now. If we haven't already, I can't see, sorry. Okay, lovely. Yes, so thank you everyone for joining. I'm going to run through the agenda of what we're going to touch on today. So for the agenda for today, we'll be running through youth mental health today, the challenges and priorities. We'll then be welcoming you to our new services, any MasterCare Plus update and our roadmap. We'll also be doing a live demonstration of MasterCare Plus and our digital front door, and a touch on how you can upgrade to SaaS if you haven't already. We'll then also have a Q&A and some closing remarks from Matthew. Okay, so for the current landscape for youth mental health then. So there are many challenges that young people are facing today. And we have noticed that 40% of young people experience a mental health disorder annually. I wanted to actually ask for everyone to either put in the chat or shout out any challenges that you actually are facing at the moment and how we can help as well.
We've got one in the chat, so integrating pathology and radiology results and e-scripts as well. So we can certainly have a look at how we might be able to help there. So making data compatible with Happy, which is a Headspace thing. Yes, I've heard this a lot from our Headspace organizations. I'm sure a lot of you can agree.
Any others? even if it's just, within the community, any challenges you're facing or things that you keep seeing come up.
Can MasterCare be linked with CMI? Question from Robin. CMI, do you want to touch on that?
CMI is the clinical, I don't even know what it stands for, that most acute psychiatric hospitals use. And there is a function that it looks like there, but when we've tried to utilise it, and then I have asked a lot of questions and people say, no, it can't be done. But when you go into MasterCare, there's actually a CMI drop option. Okay. That I've been told it can't be enabled. And I'm like, well, why is it there?
Cool. Okay. We'll have a look at that one and might come back to that in our Q&A if you don't mind.
Yeah, if that's okay. Okay, thank you. I think maybe that would be enough for the challenges. So we can look now at the how we can help our young people. So we can listen, encourage and support. We can engage young people through community and school level, create safe spaces and early access, reduce wait times for care and increase services. Also giving them tools and opening pathways to allow young people to feel connected, safe and supported. Any other ways that we can help, please do shout those out or put them into the chat as well. Okay, so now we'll just have a look at the national youth focused organisations within Australia. So some of them we are fortunate enough to work with, and some we don't actually work with at the moment, but would obviously love to help wherever we can. We just wanted to shout out some of the amazing organisations that are doing some amazing work within the community today. So a big thank you to all of you. We then also wanted to welcome some of our new MasterCare users. So we have some sites from the YES programs, from Headspace, from Relationships Australia. So we just wanted to welcome you to MasterCare and to Global Health. And then we also wanted to shout out some of our current EMR users that are actually migrating to MasterCare Plus SaaS platform. I'll move on. Okay, so MasterCare, how we support youth mental health providers. So we have a digital ecosystem designed to connect and support the young person and the service provider. So this starts with MasterCare Plus, the client management solution at the top. We then have ReferralNet, which is our secure messaging platform. We have LifeCard, which is our empowerment app. And then we have Hot Health Digital Front Door, which is our client-facing portal. So a bit more information about each one in the next few slides. So what features do we have that are designed with mental health in mind? So when it comes to referrals and intake, we have multiple pathways, such as secure messaging via ReferralNet, which allows GPs and other service providers to send secure messages and referrals directly into your MasterCare platform. We then also have the digital front door, which allows for self-referrals, or you can also create your digital referrals online and link them to your website so that GPs and other care providers can fill those forms out directly on your website. And these also land straight into your MasterCare Plus inbox. We then also have the referral management module, which allows you to track your referrals and set specific KPIs to manage what stage each referral is at. And following on from that, we then have waitlist management as well. We then have communication and engagement tools. So these are performed in the digital front door with the communication features such as the chat function, the events module, news and article sharing. We also have a group functionality. We then also have telehealth appointment hosting enabled within the platform. MasterCare Plus also allows for preferred name and pronouns to be displayed on a client's record. And again, I'll show you this more in the demo. And coming soon, we will provide an ad hoc SMS communications tab. So you'll be able to connect with your young people via SMS in a communications tab. We then also have specifically created outcome measures, digital assessments, care plans, risk assessments, progress notes, and a whole heap more that you can fill out digitally, and you could also have completely customized to your actual assessment. So anything you do on paper can be created digitally. We then also have group appointments enabled, and we can also have multiple locations and teams all operating from the one SaaS platform. Last but not least, we then have our reporting. So we have internal Power BI reports, dashboards and analytics, including a Headspace operational based report, which will be coming soon. Okay, so I'm actually going to go into a bit of a demonstration now and actually show you some of what I have just spoken about. Let's start off with the digital front door and some of what I just spoke about. So in the digital front door, or Hot Health, it is called both, but I always refer to it as the digital front door. We have our forms. So our digital forms that are created in the digital front door and then sent via secure messaging into the MasterCare Plus inbox. So an example of this may be a self-referral form. And I'll just show you here. This is one that we've created previously for one of our Headspace sites. So you have mandatory fields, tick boxes, address lookups, all of that good stuff within the form. And you can basically create any kind of form you would like, any information you want to capture within the digital front door. Okay. We then have our chat function. So our chat function allows you to chat with individuals or with groups. So for example, we have a school support group here that I've started a chat with, or I could start a chat with an individual as well. We then have the event section, and you can see I've popped in our webinar here. You can host the events online or in person. You can add locations and you can take attendance as well. We then have the news and articles section. This allows you to share information which can be tailored specifically to groups, or you can have it for the public as well. So these groups you can create with your young people or family members. You could have different groups for each cohorts of people. And then that information is tailored specifically to them. And then lastly, we have the appointments section, which you can take online appointments through here, but this is also where your telehealth would be hosted. So that's the digital front door in a nutshell. Obviously, I am conscious of time, so it's just a brief overview. And now I'll move into MasterCare Plus. So this is MasterCare Plus, and this is our SaaS platform, our client management solution. And you log in via your username and your password. Let me log in. And then you can select your team. So MasterCare Plus is based off a team hierarchy structure, which means you can have an overarching team, then you can have multiple sub-teams within that and sub-teams within those. Basically, you can have the team structure however you would actually want it within your organization. And you can have different permissions set up for each team and each user within that as well. So it can get quite intricate. We then come into our homepage as such, which has those referral KPIs, which I spoke about before. We can see our open cases, our new referrals, our new messages in the inbox, and our waiting room. This has been configured like this, but it can also be changed around if you wanted to have different things showing on the homepage. So if I just go into our inbox, and we'll see some documents that have come through from the digital front door. So some of these forms that I have filled out previously are now in the MasterCare inbox. So we can process these documents straight away against a client's file. So if we press process, the system will then try and find the correct client within the system, and we just use that human verification to make sure that that's the correct client. We press yes and select. We then, once we've processed the document as a referral, we can see these referrals in our KPI widgets here. So we can go into the widgets and we can see which stage each one's at, and we can actually action them from there. So a workflow that might be relevant to some of the people on this call is that you'd have the referral come into the admin team. They'd be notified that they need to assign this referral maybe to the intake and assessment team. The intake and assessment team would then triage or choose to additionally triage, and then they'll send that referral back to the admin team to schedule in that young person and then communicate to the GP as well. So that's the kind of workflow you could use there. So now I'm just going to go into one of our clients to go through an example of some of the other features that I spoke about in the slide deck. So when you come into a client's record, you can see an overview of their personal details. You've got demographics, and as you can see here, we've got the pronouns up in the top there. Then we can go into the clinical documents, and we have a few examples in here that I've already set out prior to this demo. So we can see the an example of the IAR. This is an outcome measure. We've got K10s in here, another outcome measure, also provides scores. We have an example of a mental health and wellness plan, which actually has the drop downs if you can open them up. We have progress notes, so I'm trying to rename it, referral letters, risk assessment forms, a whole bunch within there. You can also add attachments from your computer, but very similar to the digital front door, we can create any assessment or any document that you may require to be filled out digitally within MasterCare Plus. And we already have a whole heap already created specifically for youth mental health. So as you can see, there's a number of different modules up here, which I won't go through today, just for the interest of time. But if you would like a full demonstration, then please feel free to drop in the chat or reach out after this call and we can organize that so we can go through everything. Now I'm going to run into the appointment section. So you can see this appointment book, and this is based off of our rosters. So I've set up my own roster to enable me to take some appointments at different times and different types of appointments. I've also set up 2 group appointments within the appointment book as well for myself. So if I wanted to book an appointment, I just click add, and then I can search for the participants by their name, or I can actually search by a group. So we've got a school support group that we've already previously created, and now we can actually book an appointment for them without having to add each individual from that group. We then have the Power BI report, which I will just quickly pull up. Do bear in mind this is a demo site, so it's not going to have heaps of information in there, but let me just change the date so we get a bit more in the report. And there we can pull this information from the system directly into a number of different formats. And I also forgot that you can also search by available slots as well with a number of different filters up here. So very nice and easy to use appointment book. We then also have some more reports up here. And these are also Power BI reports. And as I said, there's a new report coming soon, which will be the operational based report. Yes, Emily.
Just to interrupt, so that report will help with what you were asking earlier. The question from Tim about making data compatible with Happy. That operational based report will be more compatible for comparing data. I think, Phoebe, if we could also look at the question about integrating pathology and radiology results and on e-prescribing.
Thank you for reminding me. So if we go into, I know we said we wouldn't go through these modules, but seeing as we've had the question, we will. We'll go into the medications tab here. And from here, we can do e-prescribing. So if you do have, say, a GP working on site, then they can use this system as well. And they can e-prescribe directly from MasterCare Plus. I'll just see if MIMS is on.
MIMS is not on here.
MIMS isn't on, but it does use MIMS to catch the drug-to-drug interactions as well. Mm-hmm. Does that answer the medications question?
Yeah, and we do have digital orders, so you can type it in with everything pre-populating, and we've some integration with Sonic for digital results. Happy to integrate with other pathology providers as well.
Yes. Thank you. Any other questions at all?
You here in the chat, can an admin view everyone's appointment book at the same time?
Yes, if you set up their permissions to do so.
Okay, so is there a way to record self-referral phone call inquiries without making a client profile? So I can take this one. No, you have to make the client to record a referral against them.
But you can do manual referrals.
Yes. Does MasterCare Plus rely on MIMS to record allergies like MasterCare EMR? Damon, I might let you confirm this one.
Yeah, you can add custom medications, which case it won't, but in general, it does use MIMS for prescribing and e-prescribing contraindications, drug-to-drug, drug-to-allergy.
Mm-hmm. And do the allergies rely on MIMS as well?
Yes.
Thank you. Okay, and there's another question here. Will a referral of a new client populate the client info into the profile? Yes, some of it comes across and will populate, so you can create a client in 3 clicks. We do have more coming across very soon, hopefully, that will allow for less and less administrative time.
Yeah, we have to be very careful about adding support for extra stuff because the formats and what we get through from external systems isn't always the same. So if we auto-populate information, it can be wildly wrong depending on the system it came from, and that's caused some significant issues with other clinical systems in the past that I'm aware of, not global health ones. So we are adding it and expanding it over time, but we're doing so cautiously and slowly.
Thank you, Damon. Okay, so if you really enjoyed my demonstration or you are looking to upgrade to MasterCare Plus, then here's a few ways of how you can do it based on what position you're currently in. So for our current EMR users, you can book a meeting with us to discuss. We can confirm your transition. You'll work with our project team to implement and migrate your data and help train you on MasterCare Plus. And then you'll go live and we'll be right there with you. If you're hoping to switch to MasterCare Plus from a different client management solution, then feel free to book in a meeting to discuss and we can scope the work with you. We'll then have the project kickoff. We'll migrate your data into MasterCare Plus. We'll configure your forms, set up your teams, and provide training. And then you'll go live and we'll be happy to welcome you on board. But if you are in a different position and you actually don't have a CMS, you're currently using paper, this is your first time implementing a CMS, then feel free to book a meeting with us to discuss your workflows and your needs, and we'll help guide you through. Once the proposal's accepted, we'll kick off the project. You'll go from paper to digital. We'll provide training, and then you'll go live and you're now digital. So yeah, as I said, please feel free to drop in the chat, email me separately, or speak with Emily or Tanya about moving to MasterCare Plus. I'm now actually going to pass back to Tanya, who is going to talk through CRC.
Thank you very much. So, Global Health is working with the Collaborative Research Centre through La Trobe University, and we're looking at a project through the Care Economy Initiative. It is really a fabulous initiative, and the project we envision really recognises that Australia's mental health community is under pressure. So we've got long wait times often for care. Staff are really difficult to identify and retain, and way too many people only getting help when they're already in crisis. So our concept is a project we're calling MindTrack, and the plan is to change that. So we want to work with a small group to create and deploy a digitally enabled early intervention program that really helps clients to track what's going on with them and giving providers the tools to respond more effectively. So we are looking at using the tools that we've got within Global Health. So certainly MasterCare Plus as the foundation, but self-monitoring through our LifeCard solution. So LifeCard, personal health record, allows clients to track where they are, what they're feeling, how they're feeling, collect all of their medications, collect all of their pathology results, look at how they're adhering to any medication plans, care plans, all of those sorts of things, and importantly, puts that person in the center of being able to control where that record goes. So really looking at them being able to share with people broadly for a limited amount of time, but they set the terms of who gets to see what. Then self-referrals, assessments, and surveys using our digital front door. So letting clients self-refer, complete information, register their information, undertake assessments, and do pop-up surveys, just as well as helping them manage appointments. Then we're looking at some AI-driven analytics. So those analytics, again, through the university, look at tracking, picking up early warning signs of any deterioration. So risk stratification. Is this person at risk? What can we actually see and be able to act on it? And then looking at referral net and the team's dashboard that Phoebe showed you a little while ago, look at pushing those, funneling those through the referral management section and being able to pass that information to the people who can best respond, but being able to escalate really quickly. So for us, the key thing is that we can avoid presentations at acute facilities, avoid self-harm as much as possible, and better use of the resources that we've got. So overall, we're looking for delivery partners who can help us co-design, test, scale the model. We're looking at about 100 to 300 clients in the pilot phase, and we're looking at how do we turn this into a commercial proposition, but one that actually can expand nationally. What we really want to do is prove that data-driven, consumer-led, digitally connected care can absolutely transform the way that community mental health delivered. So very early in the process, if this is of interest, please drop a note into the chat and we'd love to talk to you some more and follow up. And over to you, Phoebe.
Thank you, Tanya. That was great. Okay, so now we are moving into question time. So to get everyone warmed up, because I know it's a little bit scary with so many on the call to reach out with your questions, we've collected a few that have been frequently asked. So I'll go through these, and then whilst I'm doing that, please pop in the chat, please take yourself off mute. I might stop presenting for a bit so I can see everyone, and we'll go through some questions. And no question is a silly question. Okay, so number one, can you use MasterCare on the go? Absolutely. So MasterCare Plus is completely responsive. So it works on mobiles, tablets, basically anything that connects to the internet and has a screen, it will work. Can our GPs use this too? So we did touch on this a little bit earlier in the presentation, but yes, absolutely. So we do have e-prescribing enabled in there, and we do have a number of GPs already using the system. So absolutely, GPs can use this as well. And it would be recommended for them too, if you're using it, so you can have everything stored in one place. Is there any AI or automation? So at the moment, we actually don't have AI within the system, but we are looking into this, and it is coming very soon. We're just being cautious, making sure we choose the best AI tool to aid the platform. So absolutely coming soon. Watch this space, but not just yet. And what level of security is within the system? So in terms of cybersecurity, we are ISO 27001 accredited. So we have a very high level of cybersecurity. But then we also do have the security within the system, so such as your teams, your permissions, and your roles, all that kind of configuration. That's all part of the security as well. So you can really narrow down on what each user can do, what each team can do, and what everyone can see, that kind of thing. Okay, so I'm going to stop sharing, and I'm going to join the call so I can see everyone. Now, please shout out your questions or pop them in the chat. Don't know.
Here is one. Will we be able to create templates for client notes?
Yes, absolutely. So for client notes, you can have whatever template you'd like to create. We can create it for you, or you'd be able to create it yourselves. There is a form and template builder within the platform.
We also have quite a few case notes, mental health assessments, care plans, risk plans already there as well that you can utilize as a basis. Next question. When is the ad hoc SMS expected to be released?
The ad hoc SMS, that will be released as soon as we're happy with the QA of it. The development's been done, it's in the final stages, and as soon as we're happy, we'll release it. We don't want to release it and people have issues. So the quality and stability of it is important to us.
Perfect. Thank you. Okay. Are risk assessment / safety plan templates able to be customized? And will there be options for notes such as this to be reviewed / co-signed by a second staff member?
So,
yes.
Oh, you go.
Yeah, sorry. So yeah, two things there. First of all, on the risk assessments and safety plans, they're completely customizable. You can start off with the templates that we give you and customize them later on, or customize them straight away, or build your own from scratch. Secondly, the option for notes to be co-signed. So yes, you might have 2 signatures for co-signing, or in clinical documents, there's also a submit for approval button. So if I'm, say, a junior member of staff, I can fill out this maybe intake assessment and submit it for approval for somebody else to sign off on.
I think we have another question. With the digital front door, digital forms, would we be able to create and update, change these, or would we have to go through support for this? So no, you can control that yourself. You'll have a form builder in the back end that maybe your admin will be able to access, or whoever you choose to have access to can change them themselves, create new ones from scratch. Basically anything you want to do with the forms you could do.
Mm-hmm. Also, the forms have language translations in up to 80 languages, I believe. And we also have voiceovers. So it's really good for different linguistics through digital front door. In the meantime, what I'm going to do is just pop up the e-prescribing section so we can have a quick look at that and orders and results. So as Phoebe showed us, these are all the different features that you can use. You can use some, you can use all, or you might just use one, such as e-prescribing. Again, we have MIMS here, and you can go ahead, type in your drug, and then fill out your information for your actual prescribing, and you have your leaflets here as well. Okay, so your consumer medical information sheet, your product information. Again, this will pick up any drug-to-drug interactions or any allergies. And at the bottom is where you can carry out the e-prescribing. And here you'll see you have a few options, such as send via SMS, print with the barcode, or send it directly to the pharmacy. So that's just a little snapshot on our e-prescribing. You can also report on a drug as well here. We then have our electronic orders and results. So here you can go ahead and do your pathology order request. You can print it off. Again, if there's more integration to pathology providers, ideally everything is digital. But what you can see here is that it pulls in all the information for this client. You can then go ahead and start typing your requested tests and adding them. Some of this is actually customizable as well. And then go ahead and save as complete. Or, as I said earlier, there is the option to submit documents and orders, etc., for approval and for a secondary sign-off. So ideally, if you're using MasterCare Plus, the appointment book there would be your source of truth. That's also for reporting and has other implications. You can download iCal reminders. Okay, so can we choose which number the SMS goes to? On EMR, it defaults to the main phone number.
It will go to the recorded client's mobile number. Damon has said only one number is supported, so you just have to update the mobile number.
There was a question earlier about linking to CMI, and just on that, I wanted to clarify there are many types of CMI. It's a commonly used acronym. So the CMI in this case, were you talking about the statewide mental health system with mental health orders?
Yeah, that's right, because we're funded by our lead agency is a public hospital, so we do some, so we'd like to be able to integrate it.
Our MasterCare EMR product currently does, and the status is shown, so it should be possible for us to get that feed that we already have from CMI and direct it into MasterCare Plus, but it's not work that we've scoped yet.
Yeah, that's just interesting because the last time I inquired, we were advised that we couldn't have it enabled on our MasterCare EMR.
I haven't touched it, to be honest, or heard anything from it for several years, so maybe something's changed. But certainly about 5 years ago when I first looked at it, and we did have it syncing from EMR into MasterCare Plus at the time as well, it was working then. So we'd have to take that offline to follow up to see what the status of it is in EMR currently.
Yeah, great.
As far as I know, it's still working, but we'll follow it up.
Yeah, great. Thank you.
Thank you, Damon. We've had a couple of other questions as well. So, will other contact numbers, e.g. for next of kin, be able to be recorded on the client profile easily? So there is a next of kin section within the client details, which I just didn't touch on because for the interest of time. But yeah, you can record next of kin details. Oh, we've got a few more, lovely. Is there an internal communication message function to share information between individual users, e.g. admin and clinician? At the moment, there isn't an internal communication / message function. There is a way to share notes on the episodes or encounters, so you can leave notes for admin and clinicians, and there are other ways to kind of share that information, but not an actual messaging or chat function at the moment. Then another one, without using the digital front door, will the information on the referral form be compared to an existing file, or will staff need to compare and update this manually?
Okay, so a few things there. The inbox doesn't have to be from the digital front door forms. It can be from other sources such as GoFax. You might send a referral in via GoFax, or maybe it's a referral coming from best practice. When that lands in the inbox, it just depends on the file type, if we can pick up info or not. If it's a manual referral, if somebody's coming in with a paper-based referral, you can manually add them then, but you can register the client with limited information, such as I think it's name, date of birth, address, and a few others, just to get started, and then add more information later on. I'm not sure if that answers your question, but does that give you an idea, Madeleine?
Yeah, it does. That's good. Thank you. If we had them come through as like a PDF, is that something that can be compared by the system, or is it something staff will have to do like a paper-based referral?
It's something staff will have to do currently. If it's coming in as a PDF from somewhere like best practice, there will be some client and referrer information, very minimal amount, that will pick up and automatically add, but most of the referral details themselves you have to key in from the document.
Yeah.
Thank you.
It is one thing and a possibility that we've thought about possibly adding AI in to read it. The problem is it does have to be trained on the different documents, and so it's largely a per customer training. That is changing over time, or reasonably rapidly, so maybe in another year will be more feasible to do that.
And just on that note as well, it doesn't just have to be a referral that comes in from the digital front door. It might be a K10 that comes in, or an experience survey, or it could be a consent form from a parent, for example, that comes in digitally through those web links. You can essentially make any type of document and have that come into your inbox. And you can also have different inboxes. So you might have one team getting referrals and another team getting those experience surveys. So you can direct them as well to different inboxes.
Will SMS be able to be replied to? Will this go to anywhere?
Yeah, I was starting to type a reply to this, but it's just easy to say it. And so appointment reminder SMSs are two-way, and they can automatically update the appointment status for you if you configure it to do so. So that's one item. And with the ad hoc SMSs, they can be replied to, and that goes into a client communications page. It'll be a new tab in the client record where you can send messages at the moment via SMS, but in the future via email possibly as well, and you'll see replies coming back in there as well. You'll also see the SMS appointment reminder emails for the client in that same tab.
And we have another question in regards to duplicated files. EMR currently keeps all client files but flags which one is current. When merging files, does MasterCare Plus keep it as one profile?
It will keep it as one profile. What do we do when we merge clients? We mark the main client detail as no longer used, essentially move it off to the side so it doesn't appear in your searches. And we swap all documents and things, we attach them to the other client, main client profile.
Can we see the operational base report?
So the operational based report, the one we're talking about that replicates the happy information from your PHN comparison report, that is coming out very soon. We can certainly show you when that's out. I can show you some of the other Power BI reports that we have currently available now in a moment, or Phoebe you can. And we want to see a client's file again.
So here is an overview of the client details. We do also have a client dashboard here, which we didn't actually touch on, which I can show if you would like. There may not be that much information because it's a demo patient, but you can see draft clinical documents, current appointments, and this is where you'd also assign this client to different teams and different staff members. And we'll go back here. We can also capture consent for my health record uploads, that kind of thing, or even SMS or email. Healthcare cards, so Medicare cards, that kind of thing, all can be captured here.
And there's one question here on this page for can we see the gender options?
Gender options, yeah.
They're actually changing. The next release will have both gender and sex.
Okay, thank you.
And they'll align with some of the community health programs such as PMHC in terms of the items you can select.
Thank you.
So aligning with the Meteor National Data Dictionary.
Will client alerts flag on the main profile? So if a alert is set up, which actually isn't set up for Phoebe, but we can add a high priority alert. So yeah, we can put a drug or something like that. When you go into Phoebe's profile for the first time, that alert will pop out. So it will alert every clinician when they go into the file for the first time that there is a high priority alert or medium, whatever you'd like. Is there a search function for clinical documents? So we go into clinical documents. So you can filter and sort the documents. You can also, you could sort by the document type and name or create a date. You've got a number of different ways. You can also group them, again, by a number of different ways. And you can filter as well. And you can type in the value. You can also amend the name of any documents. But you could also restrict this functionality if you don't want some users to be able to edit names of documents. But you can do as well. Can anyone make that alert inactive, or does it have to be made the deactivated by the staff member who entered it? So no, basically it would be based on your permissions. So you may have that some staff members can deactivate an alert and some can't. It just depends on the permissions, but it doesn't have to be the staff member who entered it. Will the alert still flag each time a clinician accesses the file, or will a clinician need to remember to look at the alerts tab?
Mm-hmm.
So what happens with the alerts is when you access a client's record, any high priority alerts pop up straight away. You can also see them. Any other alerts in the patient banner, they're off to the right. If you then just move within tabs within that one client record, it won't pop up each time a page loads, but if you go to another client and then come back to the client, it will pop up again.
I also think we didn't address one of the questions about My Health Record integration, and we do integrate with My Health Record, so you can upload directly to My Health Record. It's just not enabled on this tenant.
As well as download from My Health Record and configure what sort of documents you want to see from My Health Record, because it's getting populated by every Medicare item and everything else, so it can be quite voluminous if you don't have filtering on it.
There we go. There's the alert popping up. And you can add tags to this alert as well.
There was one question about searching for clients.
Yes,
can you
that's
search by the date of birth?
So you can search here by surname, first name, date of birth, gender, mobile, and then you can also search by ID number as well.
Answer your question on searching for a client. And don't forget, you have the quick access to your clients on the left-hand side, where you can see your clients or your team's clients.
I have played around with MasterCare a little bit, and we haven't been able to successfully use the search function for anything except for last name, unfortunately, with trial data.
You actually have to put in the comma in between. So if you put comma and then first name, it'll do a search direct via first name. If
Okay,
you put
that's great.
ID equals X instead, no comma or anything, it will search via the ID. But yeah, you do have to follow the format that's there.
Thank you. Someone's asked, can we show the wait list? So if I just go into the wait list, I did make one, very small one, prior to the demo. So
While they're doing that, yes, you can add multiple users to a client at the same time. You can assign teams to clients or multiple users.
From the waitlist, you can email directly, or you can call from the waitlist as well, just by clicking on the email or the phone number. And you can add clients from here to the waitlist. You can add clients from an appointment to the waitlist. You can add clients from the referrals to the waitlist as well. There's a number of different ways you can add clients to the waitlist. Notifications are up here, so you'll be notified if you have those notifications turned on for those various activities that you've just mentioned. So about adding a note or a document. You can also turn on email notifications as well. So if it's an important action that you need to make sure you're made aware of, you can set that as an email notification, as well as a notification up here in the right-hand corner. Will permissions allow for authorized persons to delete documents from a client's file? Yes. Again, completely up to you who you decide can delete document. I believe I have permission. I can remove here, and then you have to give a reason as to why you're removing the document. Someone said, but it won't automatically upload to my health record for young people who are concerned about info sharing.
There is state-based legislation on it. So federally, yes, it's an opt-out system, and by default you can do it. But there is also state-based legislation on top of that, and some states have opt-in. In MasterCare Plus, you need to have recorded consent to upload. However, you can configure the consent requirements to be either opt-in or opt-out in this case.
Yeah.
So you can effectively turn it off and then just note the cases where you don't want to do it.
Yeah, thank you, Damon. Can visit notes be retitled to reflect the contact/service provided? Yeah, so you can rename anything, any of these documents here, and also within episodes and encounters, which we won't go into too much detail today, but you can also title the services specific to the service you are providing. Thank you, Emily.
Also, question, is there a way to easily identify who a client is assigned to in the dashboard?
Identify who a client is assigned to. Yes. So yeah, in the client dashboard, you'll just see an overview here of the team and the staff. And then on the side of the where you search for your clients, you've got your clients there. Those ones I'm assigned to. You've got the clients your team is assigned to, got your recently viewed, and you've also got your teams recently viewed there as well. It's easy access.
Just note that those ones are limited to the most recent 20.
Thank you. Yeah.
So that if you have 400 clients assigned to you, you're not going to see all 400. You will have to search. There are also reports such as this one right here, which shows which clients are assigned to which team, can show new clients, current assignments, and the like.
Yeah, so you can also pull that report if you. This is good for like workload management as well.
Yeah, so that can show any clients that have become assigned within the selected time frame, or that have been unassigned within the time frame, or any that are actively assigned within that time frame.
Great, thank you. And Madeline.
Adding on to that, so when we have young people call up, they might not know who their clinician is. They've recently been allocated. In MasterCare EMR, we just need to have a quick look in that top corner to find who that clinician is, and then we can transfer the call or book them in straight away. I'm just wondering if there's a similar function, or is it just that dashboard that's available?
No, there is not a patient banner item for it. We can, of course, do development and add it, but I
Not
would
available
suggest those header slots are in high demand, and this may not be the most important out of them.
Okay.
But we're happy to have feedback on that to say whether it's going to be really useful to have it there always shown on every client screen or not. Now, there was another one. There was one about adding GPs to the directory, and it was asking whether that could be admins or just those with the permissions. The whole of MasterCare Plus is based on role-based access controls, and it's the user acting in a specific team which determines which role they have, and you can go and add new roles. You can go and change the permissions assigned to roles and set that up however you want. I can't remember the default permissions for adding people to the directory. It might be like a receptionist role, or like a not an administrator as in software administrator, but an administrator of the practice type role. We have team members, consultants.
Yeah, let's have a look at how you do that in the client details.
What were you wanting to look at?
So if you go into the GP and care providers there, you can see the GP and care providers for a certain client. You can also manually add something in here.
This is tracking who is assigned to that client. So who is that client's GP or specialist or other care team members that might be external to the organisation.
So
and certainly when adding it to the client, it will also have the ability to add new ones into the address book, or you can go straight to the address book and do it.
And don't forget, if you need to refer on or send back a progress note, then this will help you bring up that automatically.
Yeah.
Now, when adding to the address book, that will search against ReferNet's address book to try and find people for you. And ReferNet is in the very final stages of full integration with the NHSD, which means it won't just search ReferNet's address book, but it will search the full National Health Services directory as well. So if you're doing things like wanting to send a fax to someone or secure message or give them a call, it will have all that information in there.
Yeah. And then we have another question. Do clients need to be manually removed from the wait list, or can there be an expiry date when they automatically come off, i.e. if they have already had a forwarding appointment for a later date? That's one for you, Damon.
No, there's no expiry at the moment.
Thank you.
Another one here. For what does the audit log display?
Everything.
Typing response to that now. So it basically displays everything, every action that happened throughout the system, from just viewing a document all the way to editing or trying to remove it or soft delete.
Yeah, and there's also client-specific audit logs as well. So you have the whole system, and then you also have client-specific as well. A report from that as well. So it's a good way of making your own report. Is there a way to filter clients per staff member, for instance, for management or audit caseload? I think we did touch on this, but I'll just quickly, in case anyone missed it. So it's in the client reports, we can see client team and client staff, and you can filter that to see what clients are assigned to what staff and what teams and that kind of thing to manage workloads. GPs who currently use best practice, do the client files transfer over smoothly, or do the client's previous files need to be added on manually? So is this a question if you want to move from best practice to MasterCare Plus, or is this by just sending documents from best practice to MasterCare Plus? I guess we could answer both anyway. And I'll let Damon answer.
What was that one? Sorry, I was just looking up the wait list. Yeah, I was just looking up the wait list one because they're talking about expiries for if you wanted a wait list in case you could get in for an earlier appointment. In that case, I believe we've got functionality there to automatically remove from the wait list after a future appointment. We just can't set an arbitrary expiry time, but I wanted to confirm that.
Thank you. And yeah, Marina did actually reply to that one about best practice. So yeah, we do the data migration, so it's not done manually.
As well, this has been quite MasterCare Plus focused, but does anybody have any questions about the digital front door? Again, that's your client-facing side.
Yeah, yes, I do. Sorry, it's Robin. I just wanted to check. So when you go to MasterCare Plus, do we get support to build that digital front door on top of our existing website? Is that how it works?
So we can embed the features within your current website, so people won't actually know they've left it. Or it can be standalone.
Okay, so yeah, so we can radio. Beautiful, thank you.
And with the digital front door as well, it would be highly recommended to have that alongside MasterCare Plus, because you obviously get the benefits from those digital forms. So saving that admin burden, that kind of thing.
Coming back to the CMI one, we do have CMI working there for a few customers using EMR, but it's a very custom integration depending on how CMI is used and hosted for your organization or access.
Yeah, so ours is still hosted via an app based, I would imagine, it's a bit archaic.
Yeah, so that's something it's not out of the box, just turn it on. So in that sense, they were probably right.
Yeah.
But it would be an integration project we'd have to do based on your situation.
Yeah,
Unfortunately, it's not just a turnkey item.
Yeah, no, but that would be very helpful for us. So yeah, thank you.
Yep.
Great. Yeah, we can connect about that one offline, Robin, and have a look at the work for that. Lovely.
Thanks, Phoebe. I just want a couple of words. We have been involved in supporting mental health providers since 2002 when we did a statewide system for this ACT. And that's influenced our thinking all the way for the last 25 years, if you like, because it had to support a variety of disciplines. It had to integrate with a variety of systems in hospitals, call centers, and it made us aware that you needed the secure messaging platform to be able to share information across a team of different specialties. It also made us aware that we do need to have the consumer as a key part of the care plan, which is why we have the 4 applications: MasterCare Plus, Hot Health, the digital front door, Life Card, and Referral Net. And we've been involved with Headspace since the commencement back in 2006, 2007, I think. The first 25 sites were all running MasterCare EMR at the time. So MasterCare, mental health services is the key part of our thinking. Every one of us, certainly those of you of my age, if you like, will know someone, either your kid's friends or someone more direct or relative that has been subject to mental health conditions. And that's why it's so important for us to be able to support you guys in the field of mental health support. So again, thank you very much for spending the time, and we love an opportunity to know how we can help support people living with mental health issues better. So any feedback about what you think you want in the application would be great.
Thank you, Matthew.
Yeah.
Thank you. Okay, so I've put my QR code on the screen, so you can actually book a meeting directly through that QR code as well, if that's easier for you. Thank you so much for coming, everyone. And we will share this information with you after the session. And I think this has been a really great and informative session for everyone. And hopefully we'll do some more in the future. I do think we have something planned. Emily, do remind me of when? Is it February?
Yes, so we're hoping to have a referral management event soon, so we can all invite to that, and also a mental health event in the new year as well.
Yeah. So do keep your eyes peeled for invitations to those as well. Thank you.